Evidence-based practice is the application of clinical decision-making for patient management based on research evidence, clinical expertise, patient values and preferences, and clinical circumstances. This course will assist you in becoming a good consumer of research to help you review the literature in search of best practice based on data-based research utilizing statistical methods of analysis. Additionally, you will gain the basic skills needed to engage in data collection and analysis to further the knowledge of good healthcare practice. Evidence-based practice is a four-step process. The first step is defining the question that needs to be answered. The second step involves a literature review to collect the evidence related to our question. The third step involves evaluation of the research retrieved to determine how well it answers the initial question. And in step 4, we integrate the appropriate evidence into a specific patient situation. Let's use an example in order to understand this process. Let's assume you work in a setting with an older patient population, of which many show signs of dementia. An area of interest for you is to help prevent or slow the progress of dementia. One of the ideas that has surfaced among the staff is to involve the patients in cognitive leisure activities to prevent dementia. Now that you've determined the question, it's time to collect the evidence. The second step involves collecting evidence from the literature to help answer the question. One of the best ways to accomplish this step is to use online database search capabilities. Using appropriate search terms such as cognitive leisure activities and dementia, many relevant articles can be retrieved. Before continuing with this lesson, open another window on your computer where you are connected to the internet at the scholar.google.com site, and follow the progression of the literature search I described in the next several slides. When you go to scholar.google.com, you will see this homepage. The first thing to do is uncheck the Include Patents option. I decided to search for research articles related to the use of cognitive leisure activities to reduce dementia. Therefore, I entered the terms cognitive leisure activities and dementia for my search. Notice that since the phrase cognitive leisure activities was comprised of 3 words, I used quotes, so Google Scholar would use the phrase as a search term and not the individual words. I also only separated the search terms with a space and no punctuation. Then I selected the search button. This shows the results of my search. The bottom arrow first indicates that I deselected Include Citations. The next arrow up indicates that I chose to only search for articles since 2013. The top arrow on the slide indicates that with those search terms and conditions selected, Google Scholar has discovered approximately 147 results. Many times in a literature search, you will find that when you access an article, you cannot download the full article without a paid subscription to the journal or search company. In Google Search, the full text of the articles available for free are indicated on the right side of the screen. As I scrolled through the search results, I found an article that interested me and therefore selected to view the full text of the article. I am now able to view and save the full text file of the article. This file is included in the first week's lesson for you to download and review. Of course, we want to review many more than just one article. The articles we want to evaluate closely are those that report on experimental research. In the broadest sense of the word, the term research includes any gathering of data, information, or facts for the advancement of knowledge. Experimental research, however, is the manipulation of one or more independent variables, treatment technique, to determine their effect on a dependent variable, response. In our example, the independent variable is cognitive leisure activity, and the dependent variable is level of dementia. First, it's important to understand the different levels of experimental research, commonly referred to as levels of evidence of a research article. Experimental research articles are categorized generally into 5 levels of evidence. The highest level of evidence is level 1 and includes randomized controlled trials, or RCTs. A randomized controlled trial compares one or more treatment groups with a control group that does not receive treatment, and the study subjects are randomly assigned to the study groups. Level 1 also includes a meta-analysis of RCTs. The concept of meta-analysis will be discussed in a later slide. A Level 2 experimental research study includes those that have one or more treatment groups and a control group, but subjects are not randomly assigned to the study groups. In a Level 3 study, there is no control group and there is no randomized assignment of subjects to the one or more treatment groups. A Level 4 study is one conducted using only a single subject, serving as their own control. In a Level 5 study, the researcher reports on a case example that has already occurred and there was no initial intent to design the study. However, in a particular case, the results of the intervention were interesting and felt worthy to report after the fact, which is why it is referred to as a case study or report and not called a design. I've simplified the levels of evidence to only 5 categories. Though these are the main categories used, they may be further divided as shown on page 362 of your text. You may find other ways these 5 categories are subdivided in reviewing other sources. As you look at this article, what would you consider to be the level of evidence for this manuscript? This wasn't meant to be a trick question, but this article does not qualify as experimental research and therefore cannot be categorized into one of the levels of evidence for experimental research articles. Instead, this is a review of previously published experimental research articles to help you evaluate the evidence for the question we've posed. Do cognitive leisure activities help prevent dementia? In fact, the International Journal of Evidence-Based Healthcare contains primarily reviews of previous research regarding a particular clinical question to help healthcare professionals engage in evidence-based practice. The third step of the evidence-based practice process is to critically appraise the evidence gathered, as demonstrated in the article presented on cognitive leisure activities and dementia. Note that in the title of the article is the phrase systematic review. A systematic review is the process completed on the scientific articles retrieved during the previous step, collecting evidence. A systematic review is a concise summary of the best available evidence. There are 2 types of systematic review. A qualitative systematic review is one where several experimental design research articles are summarized, but not statistically analyzed. This is the case with the article we've been using on cognitive leisure activities and dementia. 13 studies were included in the review, but there was no statistical analysis of the results of these studies. A quantitative systematic review is one where similar experimental design studies on the same topic are reviewed, and statistical analysis is applied to determine overall outcome. This is referred to as a meta-analysis, and will be covered in more depth later in the course. Note that this type of systematic review can be referred to as a Level 1 study, but only if the meta-analysis is done on articles reporting on randomized, controlled trials. The fourth step of evidence-based practice is to integrate the evidence with a specific patient situation. In other words, in what ways does the evaluation of the gathered evidence fit a particular patient situation? In integrating evidence with a specific patient, not only is the best research evidence used to make a clinical decision, but factors such as the expertise of the provider, the patient's values and preferences, and the clinical setting are considered in making the best decision about management for a specific patient. This completes the presentation on evidence-based practice. You should now complete the related assignment for this topic.